Hello and welcome to Neurodiversity number 5. And as you can see, we're no longer on our blustery, windy dog walk, so hopefully you'll be able to hear me a bit more easily this time. So, women and ADHD. So what's the deal there? So, as we've said earlier, originally ADHD was considered to be particularly the hyperactivity side of things, and so the boys being disruptive in class got that label, and it wasn't seen to affect girls. And then we realised that actually it all goes internally and the hyperactivity becomes less, but the inattention and the impulsivity can still be there. And the hyperactivity is there, but in a different way. And then we realised that happens in girls. And so now we've got generations of women realising that they also have ADHD and always did have ADHD. But so one of the reasons for that is boys are allowed to be more boisterous, and it's a social thing. There's no genetic difference between boys and girls. As far as we're aware, it's more a case of girls just pick up earlier that they're supposed to sit down and be quiet and well behaved, and boys perhaps get away with a little bit more. But it does seem to be a social thing, a social construct. So the other issue, particularly with women, is when hormones come into play. So estrogen is somewhat protective. And so what we are finding is that quite a lot of women are doing all right through school, doing all right through most of their working life, and then they hit the perimenopause or go through the menopause and estrogen falls away, and suddenly everything goes a bit more pear-shaped and it all becomes rather harder, and they're more disorganised and can't do the things they used to be able to do. The executive functioning goes, they're more impulsive, they're flitting from task to task, and sometimes this is put down to the perimenopause, and the difficulty is that, some of the symptoms do overlap. You do get brain fog, you do get difficulty figuring out what to do, getting on with it, the exhaustion, and so on. And this was certainly the case for me, that I put a lot of my symptoms down to perimenopause. And it was only when partly I kind of went through the menopause and wasn't getting hot flushes or anything anymore, but was still being very disorganised, very impulsive, struggling to do things, it all just wasn't going away, and learning more about ADHD and getting involved with the ADHD treatment centre, that it kind of dawned on me what was really going on. So yes, there's an awful lot of older women being diagnosed, and yes, that is a good thing, because they may have been coping, but they will have been coping using strategies and believing themselves to be somehow deficient or wrong or not good enough, and that causing a lot of problems. And actually getting the right diagnosis, potentially the right treatment. Women have a tendency to collect a lot of other diagnoses along the way: anxiety, depression, personality disorders, and sometimes the treatments don't work brilliantly because it's not the right diagnosis, and actually what's going on is ADHD. So there's an awful lot more to learn, to understand, and as I said before, these are generalisations. So yes, there are some men who fit far more into the typical female pattern, and there are some women who fit far more into the typical male pattern. It's just a way of describing what's going on and the general patterns of things. But that's why There's lots of stuff on, I certainly in my social media feeds get lots of stuff about ADHD and women. There's lots of stuff out there about it, because this drop in estrogen at the menopause seems to be really quite triggering for people. It's not so much that it begins ADHD, it's that it uncovers what was already there. And obviously the men didn't have that in the first place, which is possibly one reason why more men are diagnosed earlier on anyway. But there you go, that's my thoughts and take on women and ADHD. See you next time.